Health officials across the country, they are closely monitoring a triple threat of respiratory illnesses. In fact, the CDC is reporting emergency room visits for the flu and COVID are on the rise. And meanwhile, RSV infections are also spreading in many states, posing a danger to babies and older Americans. This is a problem. Dr. Celine Gounder is a CBS News medical contributor and editor-at-large for public health at KFF Health News. Dr. Gounder, good morning to you. This is the time of the year where I struggle with the date. It's 2024, but now I'm doubly struggling because we're talking about all these viruses and respiratory illnesses. It feels like 2020 again in a way.
Oh, man.
What's the concern?
Well, we are seeing flu rates spiking right now. COVID is also on the rise. We're seeing emergency departments seeing more and more patients with COVID. We've had over 10,000 people across the U.S. die from COVID since November. So this is definitely not gone. RSV, on the other hand, does seem to finally be plateauing and maybe on the down.
Okay, that's good news. So how does it compare to what we've seen the last couple seasons, and are hospitals prepared?
Well, this is definitely a better season than the last couple. Since the pandemic started, obviously, things have been out of the norm. But at the same time, even before the pandemic, a bad flu season could really crush a hospital in terms of the number of patients coming in. And so now you have a whole new virus on top of what we were seeing before. And so there's really not a lot of bandwidth to take on more patients if people get sick.
So how do you know if you have a virus and not something else?
It's really hard to tell the difference without a test. And so you really do need to get tested. And we do have at-home COVID tests, like we've had since really close to the beginning of the pandemic, and those are still available.
When you think about masking and that being the message 4 years ago, I want to say 3 years ago, but it'll be four years ago in March. Is that going to help? You know, if you're on a plane, I was recently traveling, taking my turmeric and ginger shots and trying to protect myself, but does that really help when you look at the number of people in the hospital, like you said, and it almost seeming inevitable that we're all going to get sick at some point this season?
Well, look, first of all, vaccines do work. So they will not necessarily prevent all infections, but they will prevent you from getting really sick, especially if you're somebody who doesn't want to miss time at work or at school. I would definitely get vaccinated. If you're high risk, get vaccinated. And masks provide an extra layer of protection. And really using the higher quality masks, so those N95s, KN95s, as opposed to a surgical or cloth mask, will really help improve your protection.
How about the turmeric and ginger shots?
Well, I would go with the mask and the vaccine, and then if you want to do the turmeric and ginger.
Of course.
Oh, man.
I like to keep it natural
I'm
sometimes.
here for the turmeric and ginger. I think it works.
Dr. Celine Gounder, thank you so much.